Hello, my name is Gary Kreps. I'm a professor at George Mason University in the Washington, D.C. metropolitan area. I'm really pleased to be with you today. I'm looking forward to talking to you about the role of communication when dealing with a pandemic like the COVID-19 problem that we're all facing right now. Unfortunately, the recommendations that I'm going to be making for responding to the pandemic are not exactly the way that many countries have dealt with the problem. And there have been a number of problems with access to relevant information, with misinformation, with conflicting information, with confusing information that has led to a lot of problems. Some countries have done a really good job with a unified voice and a strong set of recommendations. I know many of you are from New Zealand, and New Zealand happily is one of the countries that has done a really good job communicating about the pandemic. Sadly, I'm from the United States, and the United States is not one of the countries that's done a really good job. So they need a lot of help, and so I've been very busy trying to provide information and recommendations to a variety of different official groups and also to the public about the best ways of responding to the pandemic. And the pandemic is still going on here in a very big way, and there's a lot of issues. And there are new issues and new findings and new challenges that come up on a regular basis. And that's one of the issues. So I'm going to launch into the slides now, and we can start talking about the pandemics. Now, the big issue is that pandemics are very complicated issues. It's not really business as usual. It's not the same old thing. And each pandemic is different because the source of disease and infection is really different. And with the COVID-19 virus, it was a very new set of problems, a very new set of issues. We really didn't know what to do about it. We didn't know exactly what was causing it. We didn't know exactly how it was being transmitted. We didn't know what the implications were for people's health. We didn't know the best ways of treating it. There were no vaccines yet for preventing it. And so we were really at stage one, stage zero, with really trying to figure things out. And so one of the big issues about communicating about a pandemic like this one is to raise public awareness. Make sure that people know that there is a serious impending threat happening within your country, within your geographic area. And they need to be alert. They need to be aware. They need to be responsive to these issues. And the better job you do in raising that awareness and getting people's attention and getting them on the same page about what's going on, the more effective the response will be. Unfortunately, there are a lot of mixed messages in many countries. In many places, they tried to compare the COVID-19 pandemic with the seasonal flu. And so people who became used to dealing with the seasonal flu and were not really afraid of it thought maybe the pandemic was no big deal either. People compared it to the common cold and said, well, you can deal with the cold, you can deal with this. Some people said that not everybody would be at risk for this virus. They said that maybe only elderly people or people with other serious healthcare problems would be at risk for the disease. So people who did not have those problems, especially people who are young and relatively healthy, were not that concerned about it and were not particularly vigilant. So it was very important for people to recognize that this is really a serious issue, that it affects everybody, that there can be some really serious negative consequences from this virus, that it can cause a lot of pain, suffering, and death. And the magnitude of the problem has a lot to do with how well we respond to the issue, especially because there are no magic bullets, there are no treatments, there are no pills, there are no vaccines that will solve the problem. Behavior is really a critical issue, and prevention is a really big issue. We want to minimize the spread of contagion as much as possible. And the countries that have done a really good job at minimizing the spread of contagion through active prevention methods have been the ones that have been most effective at minimizing problems. And the countries that were not getting a uniform, universal response, people engaging in active prevention behaviors, were the ones that have had the biggest problem. And so these are some real lessons to learn. We're still dealing with the pandemic, and it's important even to this moment to raise awareness. But we also need to try to provide people with timely, accurate, up to date, and effective information, state of the art information about what are the basic mechanisms of this disease, what are the influences of the disease, what are the best known prevention strategies for dealing with this disease, for keeping it from spreading, what are the best response strategies for people who become infected. How can we minimize their pain and suffering and try to keep them alive and healthy as best we can? All of these are really important issues, and we're learning more things as it goes. So some of the information we provided early may not always be the recommendations now. Some of the responses that we thought might be helpful turned out not to be very helpful. In fact, some of them turned out to be dangerous. So it's really important to keep updating the information and impressing on people what we know to be the best strategies and encouraging them to adopt those strategies. And then there's a lot of coordination that needs to go on during a pandemic. There's not just one group that deals with the pandemic. There are many different groups. There are the policymakers, the politicians, the government people, the public health people who establish the guidelines, who establish the rules, who implement them. There are the law enforcement people who try to maintain order. There are the healthcare providers and all of the people in the healthcare industry who provide care. There are the family members and the local merchants and all the people in neighborhoods who need to get involved to minimize negative health outcomes. And coordinating these different groups of people is not easy to do. It's really a big communication issue. So when I'm going to be talking to you today about communication, I'm going to talk about ways that we can get information for guiding communication and how we can share relevant information. I'm going to be talking about research, which is really kind of it seems like a strange thing to talk about because research and communication are not always connected. Sometimes we think that communication is a really natural activity, that we just kind of engage in it by the seat of our pants. We do what we think we want to do. But it's important in a complex health threat situation like a pandemic to really think about ways that we're communicating. What are the best channels? What are the best messages? What's the best information to provide? How can you really motivate people to provide the best support and coordinate activities? So communication it needs to be really strategic. So there are three different major functions of communication during a pandemic. There's the prevention activities, and we've talked a little bit about that, that we need to figure out what the nature of the risk is. We need to figure out where the risk is coming from. We need to figure out what kinds of strategies we need to engage in to minimize contagion and infection. And then we need to implement that. We also need to prepare. And when we know that there's a big health threat like the COVID-19, there's a lot of preparation that goes into effect. We need to figure out what kinds of equipment, what kinds of medications, what kinds of healthcare services, what kinds of support do people need? What kinds of help do they need? What kinds of education do they need? What are the issues that they're going to be facing if they're going to be sheltering in place at home? What do they need at home? And how can we prepare and provide that information and train people to engage in the behaviors that will minimize the risk? There are a lot of problems that happen with preparation, especially here in the US. We did not have all the information we needed. We didn't have all the equipment we needed. There were not enough face masks around for everybody to use. There was conflicting information about whether people really needed to use face masks. There were ineffective testing procedures, and they were not widely available. So we didn't really know who had the virus. People didn't understand that you didn't have to show symptoms to spread this virus, and that was a really big problem. So even if you were not coughing, or you didn't look ill, or you didn't have the fever, you still could be spreading the virus. And to this day, people still don't understand that. People think that if you look healthy, then you are healthy, and we don't have to maintain proper distance or protection. And that's one of the reasons why a lot of people are not using face masks in public when they really should be. And that's a problem in the U.S. to this day. And then we need to think about response. How do we deal with the right response? How do we coordinate treatment and mitigation programs? What kinds of information dissemination programs do we need that we can provide people with the latest information and persuade key groups about what kinds of activities to engage in, and then to implement those behaviors and monitor them over time? And then we need to check to see what's going on with the information, because the pandemic is kind of a moving problem. It's not the same issue, and there are peaks and valleys. So we need to know whether infections are increasing or whether they're decreasing. We need to know whether or not people are having any kinds of health problems. We need to know if there are things that they're doing that are helping or they're not helping. And then we need to figure out how to provide updates so people know how to respond appropriately. And as I mentioned earlier, those responses are likely to change over the course of the pandemic. One of the things we need to realize is that pandemics are not a new event. We've had a long history over hundreds of years of pandemics, and we've learned a lot about those pandemics. And we need to think about what has worked in the past, so we don't make the same kinds of mistakes. One of the nice things that we have now is that we have a much more robust scientific infrastructure, biomedical infrastructure, for learning about the genetic makeup of these viruses, for developing medications, for developing vaccines, for developing treatments, so that we have ways of responding. And even though we may not have the best possible treatments, we have different treatments that are available. But one of the things we need to figure out are what influences have risk communication programs had during past pandemics. So the problem that we've had now with misinformation and disinformation, you know the difference between misinformation and disinformation? Misinformation is any time we get information that's not accurate. Disinformation is when people strategically provide information that's not true for some reason. And we've had a really big problem in the US, particularly from our own federal government, from our own president, who's been providing information, disinformation, to try to minimize fear, to keep his opinion poll ratings high, to make it look like we're doing a good job. And to do that, he was minimizing the danger of the COVID-19 virus. He was saying it was no big deal. Don't worry about it. It's going to go away on its own. You don't have to engage in prevention behaviors. I'm not going to do that. And because he was providing that kind of disinformation, people were confused. Some people believed him, others did not. Some people thought that the whole pandemic was a political effort to try to undermine the president, because that's what he told people it was, and that was a real big problem. So we need to figure out how to deal with that. We need to figure out who are the different groups that need the information, who's paid attention to health information dissemination efforts in the past. What are the best channels to use? Should we be using television? Should we be using radio? Do we want to communicate online? Do we want to use newspapers? Who are the best sources of information? Should we be going door to door, providing information to different groups? Do we need to reinforce this information within communities and within neighborhoods like they did in China? In China, they had a very intricate neighborhood system for reinforcing information and regulations about prevention. And that kind of reinforcement made it very easy for people to comply. And there was a high level of compliance. And that's one of the reasons they were able to contain the virus very well. But we need to figure out what are the best ways of communicating, and that may be different from one country to another, based on the ways that people get information, and also the cultural norms within those different areas. What kinds of influences are there to the ways that we communicate, including unintended influences, negative influences, boomerang effects, where things that we say, for example, when the president was trying to calm people down, it also discouraged them from taking the pandemic seriously. And so that was a boomerang, a negative effect of his communication. I'm sure he was trying to keep people calm and happy, but sometimes we need to have a little bit of fear to be able to respond appropriately. We need to recognize that we're in a really dangerous situation. What parts of the risk communication worked best in the past? And so I really believe in the past is the prologue to the future. That we need to think about what's worked before and what kinds of strategies we know worked for different audiences that we need to communicate with. What information will help make health risk communication programs work well? So there's a number of questions I think we need to ask. What do we want to communicate about the pandemic? What do we want people to know? Do we have the best information available? If we know that the information will be changing over time, it's probably a good idea to let people know that this is the best information we have now, but we're going to be continuing to study this and we'll be updating it. So people will get frustrated when they say, well, you told me to do this before, now you're telling me to do that. They know that this is an advance in knowledge and you're providing people with the best information you have. Which are the key audiences that you want to reach and influence? What do you want these people to do? Can they do it? Do they have the resources to do what you want them to do? Do they have the knowledge? Do they have the skills? What kind of support do they need to accomplish the goals that you want them to engage in to minimize the impact of the virus? Do we have measurable goals and outcomes in mind? What do we want to achieve? What's reasonable? What's the established baseline now for the kind of activities that are going on? What are the death rates right now? What are the infection rates right now? How is that changing? If we want people to engage in behaviors, how many of them are doing it now? How many of them are adopting it? Does that change over time? Is there a strategy for making communication programs effective? Are the programs sensitive to unique differences of different audiences, including people from different cultures, people who have different health information needs, different levels of literacy, different expectations? And who are the people that they trust the most? How can you engage them? These are really important issues to think of when we're communicating about a pandemic. So one of the things I try to do to guide strategic health communication during crises like a pandemic is to do formative evaluation of risk. We need to figure out what are the risk issues? What are the needs for information? What do we know about the problem? And so this means you need to do due diligence to figure out what do we know about this issue? What are the key factors that we need to be aware of? Who are the different groups that are at risk based on what we know? And then keep updating that information. And what can they do to reduce the risks? Once again, this can be updated. The second is we need to do audience analysis of the groups that we need to influence to figure out what are their backgrounds, interests, communication orientations, and expectations so that we can communicate with them effectively and get them to adopt the information we want. What do these people currently know about the pandemic? What do they know about this virus? What are their expectations? What are the gaps in knowledge? What is the misinformation that they have? So we can provide them with information that gives them a clearer understanding. What channels of communication do they like to use? Are they used to? Do they trust? What kind of messages will resonate with them? Who are the people that they want to hear from and they will trust to provide them with information? Can we segment different key audiences to provide them with the kinds of messages that are most effective for them? There are different ways that we want to communicate with different people. People have different levels of literacy. People may speak different languages. People may have different concerns and interests. And so communication is not a one size fits all phenomenon. So we need to do a formative evaluation to guide effective pandemic risk communication. So let's talk a little bit about audience analysis. You know, there are different sources of data information that you need about audiences. You need demographic information, kind of the prisoner of war information. Who are they? Where are they? What their age, gender, race, ethnicity, education, income. The more of that information you have, the more you're able to figure out which groups to segment together. What are their current and past related health behaviors and health conditions? Maybe we need to identify the people who might be at greatest risk, like people who have immune deficiency, who maybe have other comorbidities. Maybe we want to focus on the people who are living in nursing homes, who are at very high risk. If we learn that there are different ethnic groups who are more likely to, have problems with the virus, maybe we need to figure out and work with them. What are their communication characteristics? As we mentioned before, people you have different media use patterns, different media preferences, different ways that they like to communicate. What kinds of knowledge, attitudes, values, and emotions do they have related to this health issue? Do they trust science? Do they trust government? Do they trust their healthcare providers? Do they have healthcare providers? Who provides information to people within their families? What kinds of habits and preferences are relevant to this situation? All of these are audience analysis factors that will allow us to communicate effectively. We need to figure out how to persuade people to engage in behaviors. How do we motivate them? What are the benefits of adopting behavior? What maybe we need to provide fear appeals that if they don't engage in behaviors, we need to kind of frame the information appropriately. And what are the barriers that they face to engaging in behaviors that will minimize their risk and help them to survive the pandemic? All of this information is critical in designing the communication that will be most effective at reaching these audiences. So where do you get this information? There's a number of different ways, and I think that the first way, the quickest way, and the least expensive way is to do kind of a secondary analysis of what we already know about different audiences. What information is already available? Who are the groups that are likely to have the kinds of comorbidities and other healthcare problems and demographic factors that will put them at greatest risks? Where do they live? What kinds of issues? How have they dealt with health issues in the past? Where do they get health information from? Do they have insurance? There's a lot of information available that we need to organize and gather so that we can respond appropriately. And then we also need to collect new audience analysis data because typically there's not enough relevant secondary data available through archival sources. We need to conduct new studies. And so often survey research is done, interviews with key audiences, focus groups, surveys, analyzing audience documents such as letters, photos, social media posts, online discussions to try and figure out what are people doing, what are their concerns, what are their needs, what do they know. And these kinds of data will provide a kind of a background for guiding what we want to do. So how do you use that information? The critical factor is not only that you collect that information, because we just don't want to describe who the people are who are going to be at risk for the pandemic. We want to use that information. So there's a translation process where you translate audience analysis data into program development. You figure out, what does this mean? What does it tell you for how we can guide change? What kind of audience characteristics can we utilize to design programs that are most appropriate? So I think that we need to think of ways to adapt data to meet the needs of different audiences. Once you've come up with a program to communicate to the public about the pandemic, we need to monitor how well that's working, and they call that process evaluation. Unfortunately, that's not always the case. Sometimes we think about these communication events as rather simplistic, and we set up automatic programs like pamphlets or posters that don't really change. They provide the same information. But what if we find out that people don't understand the information that you're providing? What if they misinterpret what to do? What if, when you're trying to discourage them from engaging in activities, that you're actually encouraging them? That means you better not keep using those messages. So we need to evaluate, how are people responding? We need to figure out what kind of responses do people have to programs. Are they paying attention? Are they hearing the message? Are they understanding it? Is it motivating them? We need to test those messages and strategies to see whether or not they make sense. And if we're using different programs, for example, let's say we're using applications for people's phones, do people know how to use them? Do they have access? Do these systems work? Can we get feedback from audience members about what they understand and what their concerns are, and whether the information is meaningful for them, and what kinds of questions they have? So we need to get feedback loops built in. Then we need to track these responses over time to refine the programs to make them more effective. So the communication is kind of an evolutionary process. It's not a one-shot event. It's an ongoing event of improving over time. And during the course of a pandemic like the one that we're dealing with now, there are going to be many needed changes that need to be made. We need to figure out not only how to prevent, but now that people want to go back to their normal lives, and they're opening up, how can they do that safely? What kinds of changes do we need to make in the way that we run businesses, stores, transportation, education, to allow people to re-engage, but to re-engage safely? And so we need to check that out and see how well it's working. Right now in the US, we're going through a process of opening up, where people are going back out. And I fear it's being driven more by financial issues than health issues. And I think it may be premature. So I'm expecting, and we're starting to see now, with things opening up, that infection rates are spiking up again. They're going up. That should be really important information and feedback to us for saying, well, maybe we need to change the way we're doing things. Maybe we need to cut back. Maybe we need to engage in other safety strategies. But if we're not gathering that information and we're not utilizing it, and we're not going to be able to be responsive. Summative evaluation is really critical to figure out what's worked, not only for improving the system now, but also for guiding us in times of future health crises. What is the overall effectiveness of responses? How satisfied were people with the kinds of information they received? So right now I'm engaging in a number of studies using a variety of different methods to figure out what has worked and what hasn't worked in terms of communicating about the pandemic. What do people understand and what are they still misinformed about? What was the message that really helped them to engage in behaviors? And what were messages that minimized their engaging in those behaviors? How well were they exposed to information? How much of it did they retain? What kinds of influences did communication efforts have? And we need to track that as a key outcome variable for evaluating how we've moved from the baseline. In addition, I think we need to do economic analysis. What are the costs and benefits of different communication programs? How well do they work? What was the best program and strategies and features for achieving our goals so that we can amplify them and use them now and again in the future? And what are the best strategies for sustaining the best programs for preventing and responding to health problems? And how can you build support within the community, within the government, within the healthcare system for institutionalizing these changes to make sure that we're maximizing benefit in dealing with these complex problems. So I really believe that evaluation research is a critical factor in dealing with pandemics, and we need to build it in to everything we do. We need to be thinking about what's working and what's not working and how we can adapt. What are the different sources of information that are available? How can we continue to gather information and track what people are doing, perhaps by evaluating online information, by tracking media coverage, by building in user response mechanisms to online information systems? How can we establish benchmarks that we can use for comparison? How can we test with usability testing to see whether technologies are working or not? And how can we work collaboratively with different audiences to build systems of communication and intervention that make sense within their communities? And I really believe that we need to empower people to take charge. These are their communities, these are their families, of their cultures, and they know what will work best for them. So while we can provide guidance, we need to recognize that communities have to be in control of their behaviors. And then based on this information, we can test and refine messages and programs for use now and in the future. Now, there are a number of problems that typically occur in collecting data for evaluating health crises like the pandemic. One of the problems is that there's been a over focus on cross-sectional data. Cross-sectional data is where you collect information only at one point in time. We do that because it's economically feasible, it's less complex, it's less time consuming, but we need to realize that if we're collecting data at only one point in time, it may not reflect the changing issues and concerns that occur over the life course of a pandemic. And we need to track these things over time. So I really think we need to look at ways of doing more evolutionary data collection at different points in time. We tend to depend too much on self-report data. And one of the problems with self-report is that people may not be motivated to provide the information. There's a lot of concern that in many countries, they were really reticent to tell people how bad the pandemic was, or how serious the problems were, or how many people were being infected, or how many people were dying, because it would make their country feel bad. Or people didn't want to tell that they were ill, so because they were afraid that they couldn't keep going to work, or they couldn't get out, and because they were not providing accurate information, bad decisions were being made. So I believe that we need to collect unobtrusive data that's not based on self-report to validate what's going on. We need to track things in a variety of ways. So surveillance data is really important. Weak measures are often a problem. Sometimes we use established scales, and they don't really provide the full information. So I think sometimes we need to think about using more qualitative approaches to gather in-depth information about people's experiences and their motivations. Often there's problems with data reduction, which means making sense of what we've learned from research. So a lot of good research doesn't really help because people don't understand what it means. They don't know how to apply it. So we need to try to reduce the complexity of our findings and think about ways of applying the data to improving programs. Often we don't really look for good hard outcome and economic data, so we don't know what's worked and what's not worked. So we need to be really thoughtful about collecting data about how these communication programs have affected health outcomes, financial outcomes, beyond just satisfaction. Sometimes we don't use representative samples. Sometimes we just study the groups that are easy for us to reach. But we need, in a pandemic, to identify the samples of people who are actually having the biggest problems and communicate with them. And then often, because we're in a rush, we want to have quick results, there may be a lack of methodological rigor and control in conducting the research. And I think that bad data provides bad results. There's an old saying that says, garbage in, garbage out. If you don't have good information, you're not going to be able to use it very well. So these are the practices that I recommend. These are some of the things I mentioned already. We need to do scalable evaluation. It means We may need to start small, but we need to build a whole infrastructure of research in a variety of different ways to gather data. We need more longitudinal, multi-point in time, rich data collection so that we can track what's happening over time. We may need to conduct multi-methodological research, triangulating both quantitative and qualitative data, gathering data both from surveys and from observations, from analysis of media, and from observation. We need to do unobtrusive measures so we can get accurate information, like built-in feedback systems that provide natural data about, for example, healthcare usage, access to medications, and people who are following recommendations. We can track that information. So if you ask people, are you using face masks? They'll say, oh, yes, I am. But if you have data from surveillance that shows that they're not, we know that that's really a problem. We need to think about communication and health outcomes, that the communication is just not providing information, it's supposed to have an impact. And we need to identify how it impacts outcomes. We need to demonstrate progress with the data that we collect. I believe in a cost-benefit analysis of looking at the financial issues. Often I will conduct controlled field experimental studies to evaluate the outcomes of programs over time. And I really believe in user-centered design and collaboration. I think these are ways that we can collect good data that will guide communication and response to the pandemic that we're dealing with now and also for future problems. That's the end of my lecture. I have a bunch of references that back up the kinds of information I provided today. I will be glad to respond to your questions. Thank you very much for your time. It's been a pleasure communicating with you. I hope that what I said has been helpful, and I hope that you are surviving the pandemic well. Be healthy and be safe. Take care.